A complete pain assessment is very important for your geriatric patient. Pain in the elderly population is often unrecognized and therefore undertreated. This is usually due to a lack of understanding between the patient and the provider. This situation can be exacerbated by the likely cognitive decline of your patient and a continued lack of awareness of the pain that the patient is themselves experiencing. It is also possible that the patient feels that pain is a normal part of aging, so they just accept it for what it is and not really ask for resources or ways to improve their condition. Chronic pain dramatically affects the quality of life of your patient. As you can imagine, the trickle-down effects are more than we need to list here. But then you combine that with a polypharmacy and all of those side effects, it really can be detrimental to the patient's quality of life and their current state of independence. Moreover, the geriatric patient is going to experience a decrease in metabolism of medication due to a decreased renal or hepatic function within their own body due to the aging process. We as a society, of course, need to shy away from narcotics, but many other options exist to help the geriatric patient with their pain management. So many other non-pharmacologic means to help their pain, but does need to be identified and therefore treated properly. This can be a symptom reduction or elimination, but really management would be the goal. Then if you combine one of your elderly patients with certain cultural characteristics, they might be very unable to receive pain medication if they are culturally not used to discussing it and asking for help for certain chronic or acute pain symptoms that they are experiencing. So it is very unfortunate they could sit and suffer in silence for a very long time. Your pain assessment can be completed using basic numeric rating scale, which is what everyone's most used to, 0 to 10, which is subjective. It is what the patient says it is. Or they could use a FACES pain scale to try to identify what emotion you are feeling if you're not equipped to handle the numbers. Or a verbal descriptor scale might be also helpful in the proper diagnosis and subsequent treatment of a patient's pain. Pain scores, as we know, are considered just as important as the other vital signs and are to be assessed as frequently and intervened upon as necessary.